Greetings, this is Superintendent Keith Marty, and joining me today is Dr. Robin Wallin, our Director of Health Services here in Parkway. We just want to spend a few minutes with our staff members today talking about where we are at in terms of the work of starting the school year, and certainly having Robin here to talk a little bit about the work we're doing to keep everyone safe and to also begin to track some data, some metrics, and some thresholds. So we're going to cover some things with you today that I hope is informative. Before I start, though, I just want to again thank our staff members, all of you, sincerely for the wonderful start we've had. The feedback from families and from staff members and some students has been very, very heartwarming, and that's a credit to all of you who have worked so very hard. So thank you so much, and please keep up the great work, and please take care of yourself, which is part of the message here today that we want to send to you. We really would like to get back face-to-face at some point, and to do that, all of us, myself, all of us are going to have to take care of not only ourselves, but also be conscious of others. And so, Dr. Wallin, what kind of recommendations and thoughts do you have in terms of how we as not only staff members, but citizens need to take care of ourselves here in the near and far future, potentially?
Yes, thank you, Dr. Marty. I'm very aware that COVID-19 is impacting our school community, our families, and our staff. We have seen over the past few months more than 30 staff members who have tested positive for COVID-19, and that then has a ripple effect with close contacts at home and also in the workplace. So we wanted to be sure that everybody knew what to do and how to best protect themselves. And public health authorities have mitigation measures that they are recommending to help us control this pandemic, and they apply for us here at school too. So we need to be really carefully adhering to social distancing. So that means staying physically apart from other people, which is not our nature at all, especially in the work setting. We like to sit down and have lunch together, but we very much need to maintain a distance of at least 6 feet, to wear cloth face coverings at all time when around other people, and then also to use really careful hand hygiene. We're also asking all staff members, as you know, to do a daily health screening. That's really a partnership with us. We're trusting you to go through the symptoms on a daily basis, to make sure that you're well enough to be at school. And certainly this school year in particular, we need to be very vigilant about illness symptoms and stay home if we're sick. Along those lines, we have some people that are getting trained as contact tracers to help navigate staff through this season of COVID-19. So if you're feeling ill, please reach out to your school nurse or to me in person or to Becky Cartmill, and we will confidentially help navigate you through the process of getting tested if you need to get tested, or helping you work with HR on having the appropriate leave so that you can stay home if you're sick. So I think one of the more important things for you to really understand is that we want to approach this with care, with compassion, and with confidentiality. And we are asking that of you too. So please, if at all possible, avoid sharing information that may be private that you hear about other people, but know that we will reach out to you if you're identified as a close contact. So we're trying very hard to keep this confidential, to respect people's privacy, but also to really care about our coworkers and our community. So I really do think this is a team effort.
We're coming up on Labor Day weekend, and we certainly just want people to be very conscious of not only now their school life, but also their personal life. And we know that, there's going to be some activities this weekend, but again, I think our message is please be conscious and take care of yourself away from school as well. Is that fair?
Yeah, oh, definitely. I mean, one of the biggest drivers of this pandemic regionally in the state and nationally are activities that people are doing that bring them in close contact with other people, which is of course what we want to do, right? But in this season, we really need to avoid that. So being very careful even with people that love very much, but that are outside of your family pod, to maintain physical distance, wear face coverings. One of the things that can happen if you are exposed to somebody with COVID-19 is you can be required to quarantine for 14 days, and it's 14 days added on to any days that you're exposed to them while that person is contagious. So if you have a family member that's positive, say a child, and you're taking care of that child, you're going to need to quarantine at home for the length of that child's illness, which is usually at least 10 days, and then 14 days beyond that. So a quarantine could be a 24-day adventure for your family that we've done, and that can take you away from work. So we really want you to try and avoid situations which might put you in the quarantine situation also.
You know, I want our staff to know that we're so fortunate to have Dr. Wallin here in the district. She, her background is really quite amazing. Spent some time at the CDC. I think has some expertise around infectious diseases, and certainly has has quite a background. And so we're very, very fortunate, and I think the region is very fortunate. I know she's partnered with some of the individuals who have been working with the superintendents around metrics and thresholds. And so, Dr. Wallin, do you want to share a little bit about some of that work and actually begin to alert our staff members about information that we're going to start sharing a little bit more, because we're becoming more confident in that data, and that information is perhaps how we're going to make decisions about coming back here second quarter if possible. So, Dr. Wallin, you want to just cover some of those metrics and thresholds we're talking about?
Sure. So I just want to share real briefly about some of the metrics that we're looking at and that we hope to be able to communicate with you on a regular basis moving forward, with the hopes that these will help guide us in our decision making as we think about coming back into our building. So we're looking at the transmission rate, looking at that in a regional sense. So trying to make sure that we are aware of how many people each individual who is positive is infecting. So transmission rate ideally should be less than 1. And we currently have a transmission rate that's hovering right there at the around 1. So ideally, we'll see our transmission rate go down over time. We're also looking at the positivity rate. So that's the number of cases that are positive. And it's a reflection of how well our region is doing with testing. So the thresholds for positivity rate are to try and aim for a positivity rate less than 5%. So what that says is that you have robust testing available in your community. And our positivity rate is going anywhere from 7.5% to almost 10%. And it fluctuates on a regular basis. But I think it's beginning to trend down, which means we're having more adequate and available testing. So that's a really good thing. We're also looking certainly at the number of new cases. We're looking at the number of new cases over a week or 2 weeks, and also just the general prevalence of the virus in our community. And then I think this is really important. We're looking at the conditions in Parkway. So one of the reasons that I really hope that you will feel comfortable sharing with me what's going on for you or your family is so that we know how COVID-19 is impacting our staff and how it's impacting our students and families. So we're starting to track those trends. Also, we very, very much want to be aware of conditions in Parkway that may encourage or discourage coming back in person.
Thank you, Dr. Wallin. This is information, again, that you're going to be seeing a little bit communicated to you on a weekly basis now. And so we want to gain confidence in both our ability to communicate that and your understanding, as well as our community's understanding. We get questioned a lot about, why are we going to make the decision we are in the future? And in fact, I think Dr. Wallin will agree. If you look at the data from July and August, I think we made the right decision, given some of that past data on transmission and new cases that was extremely high in the region. So we felt confident that we made the right decision now, kind of in retrospect. Dr. Wallin, I want to thank you for your ongoing work. And again, I just want to emphasize to the staff that are tuning in here that we do care deeply about all of you, and that's why we're sending this message to you. And again, we certainly do not want anyone to feel ashamed. We're not in a situation where we can sometimes, be in control of who we're in contact with. So we can not assume anything about someone who does test positive or has to be quarantined. So please, let's take care of one another. Let's not become one of those groups or organizations that, it really makes people feel uncomfortable about coming forth if they are positive or if they've got some family conditions. We want to take care of everyone. And again, I want to just close by thanking all of you so much for your work. And I want you to take care of yourself. I hope the Labor Day weekend will be restful and will be a time for you to kind of retool. I know that a lot of you are feeling stress with the work, and some of you are working so hard to make sure your students' needs, and of course now you have family engaged, and some of your teaching as well are doing just a wonderful job, and we support you, want to take care of you. And again, if you have any questions, Robin and her staff are certainly there to answer them, and we want to make sure that you feel comfortable calling, and it's all confidential, as Robin said, and we want to, again, be a family and take care of one another through all this. Thank you for joining us, and we again want to thank Robin for all her work and her expertise. We're so fortunate to have her in Parkway at this time. Have a good day.